Thank you, Sri Srikant, for the awesome presentation. You have brought ICU services at the doorstep of our homes. We will now be virtually joined by Sri Vinod Khosla, named by the Fortune magazine as the most successful venture capitalist of all time, founder and partner at Khosla Ventures based in Silicon Valley, having funded many successful tech startups, funded a lot of COVID work in India. We in Nagaland are recipients of his generosity in funding 10-bed ICUs in 11 of the 12 districts. Please welcome Vinod Khosla. He will deliver a speech from California, followed by a short interaction with our Honorable Chief Minister. Sir, please.
Thank you. Can you hear me okay?
Yes, we can hear you.
Okay, thank you. Well, I'm delighted to join the launch of the 10-bed ICU project in Nagaland. I do want to start by congratulating the Chief Minister of Nagaland, Mr. Nefirio, and the 10-bed ICU team, and of course, Srikant and his team on this occasion. I'm told this was set up across 12 hospitals, every district of Nagaland, with a TeleICU hub at NHAK Medical Center in less than a year. That is pretty fantastic. So I'm very, very excited to see what progress has been made. I know Nagaland is a largely mountainous state and a remote state, and I'm really, really glad to see you embraced 10-bed ICU care health platform and engaged your specialists at the NHK Medical Center to deliver medical care to your remote district hospitals. I do believe that this telehealth system is just the beginning of much more extensive care. It's a precursor to much better and cheaper healthcare through AI services also delivered remotely. So it's just the beginning, and hopefully, if you're interested, we can talk about what can come next beyond this that would be even more significant. I know the only way to deliver quality healthcare for remote rural populations is by the innovative use of technology and standardized clinical protocols. Given the limited number of ICU specialist doctors that can take care of a large number of patients, I'm very, very happy to have funded the 10-bed ICU wards at 11 districts and the TeleICU hub, and look forward to hearing about the much improved critical care outcomes across the entire state. Once again, I want to thank the Chief Minister Rio and the Department of Health and the 10-bed ICU team for having implemented this very ambitious project. I do hope that we will not stop there. My dream would be not only the 12 district ICU units, but I do believe small kiosks and small portable vans can make primary care offices available in 1,000 districts at very affordable cost, and then have AI complement the expertise of the limited specialists you have. So I do hope within 5 years we have a very, very different and maybe a world-defining model of how healthcare should be provided everywhere. I look forward to that and working with the team there to maybe implement that kind of vision. Thank you very much.
Thank you. Thank you very much. On behalf of the state of Nagaland, I want to thank you very much for coming on virtual. We can hear you and we see you, and we're extremely happy that you are participating in this inauguration of 10-bed ICU. the sponsors and the organizers who are with here are extremely excited, and your commitment to serve the needy people. We are in India, frontier state, bordering Myanmar, which is going through a very difficult time, and these are hilly state and have a bad terrains, connectivity is a problem. So e-medicines and through these consultations, the specialists can extend. And your commitment for the needy people, and also this will not be the end, and it will go for further expansion. That is a good news to us. And on behalf of the state of Nagaland, if time permits, if you can visit our state, it's a lovely state and people are very friendly. So we would like to have you when we have the biggest festival, in other times also, but the biggest festival, which is called Hornbill Festival, it goes for 10 days. And all the tribals of the state, we have 17 tribes, and all come together, including the whole Northeast and the friendly neighboring states also. So if you can come, we will welcome you and will be extremely grateful. I had just launched the 10-bed ICU, and also I had gone to the NHAK and the TeleHub where they are monitoring. It is extremely exciting. We can see the patients all over the district hospitals in the ICU, and also can zoom. And I think Nagas, we have very much attachment in the family. So when one is sick, either in ICU or in the hospital, everybody go to visit, which is not a wise thing, because the disease also can be contacted. Yes. But we can talk to the patients, seeing them ourselves, and the patient seeing us. So that is a big relief, and this will be very popular, and I hope my state will make the best use of it, and we need your support and cooperation. So thank you very much for what you have done. A big thank you and all the best. Thank you.